The beauty scientists, Dr. Kristy Hamilton and Dr. Kim. Real beauty without the hype.
The biggest advance to me was private equity. They had two conferences, two panels where they just handed it over to the private equity people. It's the first time I've ever seen this at a plastic surgery meeting. And there weren't that many people there. And I think this is by far the biggest development in plastic surgery, bar none.
So we know private equity has really come in and targeted medicine in general. We've seen their takeover of anesthesia groups, radiology groups were very popular, some of the larger orthopedic groups and dermatology groups, I think maybe more than all of those were very, very popular, and combining them, bringing in economies of scale and whatnot, and lumping them under one big topic. Plastic surgery is kind of resisted up until this point, maybe because there's a lot of solo private practice individuals like you and I. So what's different now, and why is it becoming a movement in the industry?
I think there are a couple reasons. Of course, there's more money sloshing around that needs places to be invested. I think I can't name all the reasons, but the ones off the top of my head are a lot of plastic surgery practices are older, specifically baby boomers. They're like hitting retirement age. And so they're looking to retire and they're looking to cash out for the maximum value. Interestingly, and this has been a trend in American medicine, if you do any procedures, no one cares. Your procedural practice, your value of your patients and your surgical skill is almost nothing. Private equity, hospitals value recurring revenue streams. So if you could see a patient every year, if you could see a patient every 6 months forever, that's what multi-specialty groups, hospitals, health insurance companies, that's what they want. Procedures tend to be a one-off and very linked to surgeons or proceduralist skill. That's the second thing. I think the third thing is that private equity has already started in so many industries. Specifically within medicine, there's private equity merger and acquisition in pharmacies, in physical therapy, in dentistry. Heck, it's coming to veterinary medicine. It's definitely happening in dermatology. As people realize, you know what, I'm a surgeon and I'm very surgical and my practice is worth almost nothing. If I have a med spa, a recurring revenue stream, suddenly people are very interested in it because they're sort of acquiring a patient list and no one's doing it. Whereas in dermatology, they've already done it to a very large extent. The only other people who really own med spas are plastic surgeons. I think that oculoplastics, facial plastics / ENT, they don't own quite as many med spas.
So it's the med spa that they're mainly interested in. And that kind of makes sense, right? Because I think always the criticism of plastic surgery businesses are that it's really, really tied to the surgeon. So if you can buy the practice, but if the surgeon leaves, then really what are you left with there? Arguably, it's not worth investing in from that perspective, unless you're like a larger group where surgeons are coming in and there's more of a cyclical aspect to it with like younger, middle-aged and older surgeons that are there.
Thank you for joining us on The Beauty Scientists. Be sure to visit thebeautyscientists.com and learn more about modern beauty and connect with Dr. Hamilton and Dr. Kim.